Hey guys, so I recently came across this question on Reddit and I thought that I would take the time to respond to it here because I feel like there are some of you who would maybe be interested in hearing my thoughts and my take on this question as well. So I'm going to say what the question was and then I'm going to give you my thoughts on it. So the question was, knowing what you know now, would you still choose to become a medical assistant or would you choose something else? So, honestly, knowing what I know now, I would still choose to become a medical assistant just because I feel like, as I've said many times on this channel, any certification that you can get is helpful to you in the future, like as far as job prospects go. It looks good on your resume when you have multiple certifications. Um, it makes you more of a rounded out or well rounded applicant. And I feel like businesses and facilities look for people who have certifications because, one, it says that you are dedicated to bettering yourself. It shows that you are dedicated to the healthcare field by actually gaining skills, gaining training in the field so that you can get that certification. There are some things that I would say I don't like about working as a medical assistant or being a medical assistant, and they have nothing to do with patient care. I feel like we don't get paid enough as medical assistants. I feel like coming from Indiana, where I got certified initially as a medical assistant, they get paid more than we do here in the Upper Peninsula of Michigan. And part of that, I'm sure, is because the cost of living is different in the area that I was in Indiana compared to the area that I live in now in the Upper Peninsula of Michigan. But they got paid a starting rate that was like the max that I could have gotten paid at the hospital that I worked in the urgent care at. So, you just have to think about things like that because there is a potential for you to not get paid as much as you would like to. I feel like most of healthcare doesn't get paid what we are worth. And I think that if you go into it for the money aspect of things or the financial aspect of things, you're going into it for the wrong reason. However, I do still think that we deserve to get paid more because of the things that we do. I've talked about this in previous videos where when I was working at the hospital full time as a medical assistant in the urgent care clinic, um, the CNAs at that hospital got paid more than us medical assistants did. And part of that was because they were contract, but we were also contract. However, the nurses were part of the same class of employees, I guess. So the CNAs got paid more because the medical assistants, even though we were contract employees, we were not under the same whatever as the nursing was. So nursing got paid more, even though like we were responsible for doing things that could literally kill someone, like medication administration and things like that. Not saying that CNAs can't participate in activities that could potentially kill someone because they do. Um, they do and they can. But when you are administering medications or vaccines and allergy shots and things like that as a medical assistant, I feel like we should get paid more than $15 an hour. Um, which when I first started out, my very first medical assistant job, I was getting paid 14.75 an hour. And I don't think that that's enough for all of the things that we are responsible for doing. So that included, having to room patients, which obviously is part of a medical assistant's job, medication administration, assisting with injections, like joint injections and things like that, assisting the provider, all of the main typical things that a medical assistant would do, but also drawing blood if I was working at a satellite clinic. Responsible for the administrative side of things, not so much like scheduling appointments and things like that, but obviously charting and things that a medical assistant does. But I would still choose to become a medical assistant because it's taught me different things and it's shown me the areas of healthcare that I would like to go into and the areas of healthcare that I don't necessarily want to be a part of. Previously, I had talked about wanting to become a nurse, and I was working towards my BSN. I still have that opportunity available to me. I also have the opportunity to become an LPN. However, I've taken a break from that and I'm looking into potentially moving into PA school um, aspirations because I just feel like as a physician assistant, um, I would have more autonomy than a nurse, obviously, because the nurses work under physicians and things like that. So I'm looking more into that side of things, which came from working with different PAs. I also worked with NPs, nurse practitioners. However, it's given me kind of feelings that I would much rather work as a PA than I would as an NP. So it's helped me to figure out what I want career wise and things like that. But I also just, it's given me a different outlook on life. We'll just say that. But I would still choose to become a medical assistant because I think that I truly enjoy working as a medical assistant, not just because I like patient care, but because I like what it has taught me. I like the interactions that I've had, the tasks that I've gotten to participate in. I've enjoyed most of my position as a medical assistant. I've enjoyed most things. So would I still choose to become a medical assistant? Yes. If I had to do it all over again, I would still become a medical assistant. There are certain positions that I would not accept, and that's a different story for a different day. However, I am happy that I've gotten the experience that I have, and I look forward to seeing what comes next for me and growing and changing as a person, both personally and professionally. So let me know if you are a medical assistant or a CNA or a phlebotomist, whatever you work as in healthcare. If you work in healthcare, would you choose to become that again, or would you choose to do the same certification, or would you choose something different? I still have different certifications that I've looked into getting. I've looked into getting like medical billing and coding, different things like that. Um, I've also looked into pharmacy technician and EKG technician and things like that. But so far, I haven't actually started working on any of those things. So, anyways, that's it for today's video. Let me know if you would change what you became certified in and what you worked as or work as in healthcare. Would you do it all over again? And, anyways, I hope that this was enjoyable for you. Hopefully, somebody got something out of it. If there's any topics you would like me to talk about in the future on my channel, let me know, and I will talk to you guys in my next video.